Hello there, I'm Brian Taylor, and a very warm summer welcome to my Herald podcast. This week as the temperatures rose, COVID constraints fell, Scotland moved to level 0, so everybody happy? Well, not quite. The First Minister stressed the need for sensible precautions to continue, and there are big question marks over how we can cope, frankly, with the renewed pressures which might come from easing constraints. The virus itself, of course, but what about the NHS more generally? What about schools? When the pupils go back? What about the leisure industry? What about the economy? All questions I plan to discuss with my panel. Let me introduce them to you. From the Herald, David Ball. From the SNP, Stephen Flynn, the MP for Aberdeen South. From the Conservatives, Russell Finlay, West of Scotland, MSP. And also delighted to welcome Kay Sillars of Unison, and Donald MacLeod, who owns the Garage and Cat House clubs in Glasgow and is convener of the Glasgow Licensing Forum. Both, of course, of those latter two very concerned about matters in their sector. David, bring us up to speed on where we are. We had level 0 on Monday, but all week it's been talk of concerns, and today even talk of possible shortages in the shops, so that's been played down a bit as well. Quite a lot happening, isn't there?
Yeah, that's right. So as you mentioned, we've moved to level 0 now in Scotland. In England, they've had their sort of Freedom Day, which was on Monday. So we're a little bit behind. We had a surge in cases a couple of weeks ago, which have kind of eased off now.
Yeah.
But Nicola Sturgeon sort of saw this as a stepping stone. But as you said, there are still a lot of concerns. Despite everyone now being offered the first dose of the vaccine, there's concerns that sort of a lot of young men, almost 50% under 30 men, are yet to be vaccinated. There's a lot of uncertainty.
Just not taking it up, or what? I mean, what's the info there?
Yeah, I mean, they've all been offered their first dose, so there's a lot of sort of vaccine hesitancy, and they've been the last people to be offered it as well. So there will be a bit of delay. But as you mentioned, there's concerns now about the so-called pingdemic, which has been hitting England more than Scotland, has to be said. Yeah. Whereas a lot of people being forced to self-isolate. So there are calls, obviously, from businesses who want the rules sort of change for some key workers to be sort of exempted from that. Yeah. It's having an impact on, it could have an impact on sort of food supplies. We've seen some empty shelves in Scotland, although that has been downplayed as sort of a bit.
It has been in the last hour or so. They're saying, look, just calm down, folks. It's not.
Yeah,
there's
also concerns it could have an impact on a lot of NHS workers who are having to self-isolate when obviously pressures on NHS are rising, and there probably will even more when restrictions are further lifted.
David, I'm going to take that cue and go straight to Kay Sillars. Kay, I mean, the impact on the NHS, you've got the virus itself and COVID wards and this hideous plague that we're having to cope with. But then there's the impact, as David said there, of staff having to self-isolate, staff being off sick as well, off ill. It must be really, really challenging in the health service right now.
Hi, thanks for having me on. I think it's really, really challenging in the health service just now, but it's important to note that these are issues that predated this crisis. It's just the crisis has hugely exacerbated the issues around staff shortages. We're just not training enough staff to take up all the jobs in the health service. Also, the mixture of staff and the skills you need. The health service is run by a whole team of people. It's not just nurses and doctors that you need. You need a whole range of health staff. And so we need to get on training on top of that. Self-isolation is clearly an issue, adding to staff shortages. But on the other hand, if people who have contacted or are contagious with COVID come to their work, and that's the same in any place, we've had these issues around how schools are going to operate. But if the staff come in and pass it on to other people, it's going to be a rolling effect, and more people will be off and could be ill.
How grave is the situation? What's the experience on the wards? What do you hear from your members on the wards? What sort of things are they dealing with?
Well, what I'd say is that I'm speaking to you today because we couldn't get a member who was available, who could get time off the work to take part in this programme. That's how tough it is.
Well, delighted to have you here. You're the policy lead for health, expert in the subject, but folk just cannot get a second off work to
Can't get a second off work. People are, you'll get more details from health boards. They can't fill the vacancies. There are lots of shifts where they're operating really short-staffed, and I'm sure there'll be more details coming out this weekend. There's certainly a lot of meetings going on as we speak to look at how we can keep getting these things covered and how we can cope with the self-isolation. So there's a lot of discussion, a lot of attempts to sort it out. But the vital thing is that we can run a service, but also we can't run a service without enough staff. And I suppose the other thing to add in is lots of nurses that we'd be expecting to qualify now. Not everyone got to do their practical work. So there is a shortage of trainees coming on board.
Okay. I saw one report that said A&E emergency admissions are higher than they normally are. And the suggestion was that folk had been holding off going to the doctor because they were frankly scared of getting COVID. They were holding off from primary, and then at the last minute, God, I'm so ill, I've got to go, and they go to A&E. Is that the experience?
It's a twin-edged sword because people are also iller now when they're coming forward.
Yeah,
where
they come
if they'd
forward
come
too late.
forward earlier. So
later than they'd want. Yeah, okay.
Later than they'd want. So need much more intervention than they would have done if they had been able to come forward or get treatment early in their illness. So it's not so much that there's loads of COVID cases creating problems in hospital, although that is ongoing. It is the wider health issues that are now emerging that are adding to the pressures.
Okay, thanks. Let's bring in Donald McLeod. Donald, thank you very much indeed for joining us. With the liberalisation, pubs able to open or continue serving until 12, but that has done nothing for the nightclub sector at all, has it? I mean, how are you being affected in Scotland? Presumably, it's pretty grim.
It's very grim. It's very worrying. And in fact, when we say we were going to level 0, we didn't go to level 0. We went to level 0.5.
0.5, yeah.
There was a curfew brought in for midnight. We're still still social distancing. There's still mask wearing. There is no dancing, no singing allowed. And if there's live music in a place, that it cannot be louder than somebody talking. The guidance is ridiculous. It's over the top. I think it's not helping people move out of this in any meaningful way. And as far as nightclubs are concerned, well, we still have no date. We're getting told that we possibly could go beyond level 0 on the 9th of August, but that none of us believe that. And in fact, in a recent survey of the NTIA members, that's the Nighttime Industries Association, 98% of them had no faith in the government and what they were doing in support of the business.
Nicola Sturgeon on Tuesday said nightclubs do pose a risk, she believed, to transmission of the virus. She understood the concern, she understood the worries, but she just basically wasn't persuaded that they could be opened safely.
Well, that's been the sort of standard line from the Scottish government of late, and it's a government I used to support, hands down, that they understand, they get it. But we speak to a lot of advisors who then go to the upper tier of government to get advice on guidance, where we're going, to get some plans, to get some meaningful dates, and they come back with nothing because they're not given anything. We were promised by the Deputy First Minister at Glasgow Task Force 4 weeks ago that we'd be consulted before moving to level 0. We weren't. It was just dropped on us, and the changes therein were dropped on us. Now,
do you feel let down by that when you look at the situation in England? Do you feel let down by the Scottish government?
Totally, absolutely. In fact, there is a great fear that actually the plans have already been written to write us out of the economy. Divide and conquer, and if anything, we won't get open until next March. Now, I don't like believing in fairy stories, but there's more and more evidence coming up that could well be the case. So I don't think we're getting told the truth. I don't think we're getting supported enough, and 40,000 jobs are at risk, and most of our members are £150,000 plus in debt. Plus, they're also we're waiting on say core funding. That's 6 weeks or to 2 months too late. And one final thing here on this is that most nightclubs do not operate just as nightclubs. They operate as live music venues. Now, there is no certainty that we can get open there. So I personally have 200 shows that I'm going to have to move because we're not getting given the guidance. And when the guidance does arrive, it's invariably late. It's a patchwork job, and we can't move forward. I think the government where they started off well, are micromanaging this to such a degree that they're tripping over themselves and not getting the points out correctly and not supporting business, whether it's retail, whether it's hospitality, whether it's the health service, or whether it's sport and so on, or aviation. It's a crisis.
Donald, thanks for that. I'm going to come back to the health service in a moment. It's two very distinctive topics. Stephen Flynn, what do you make of that about the economy, the leisure industry, and a suggestion that the Scottish government just didn't consult and let folk down?
I think, Brian, although it would be useful to separate the two issues there, I think they're actually interlinked in terms
of
go
for it then, that's fine.
In terms of what Kay and Donald have said there. And in fact, it kind of exemplifies the challenges facing government, because on one hand, we have Kay rightly highlighting the pressures on the NHS at this moment in time and the difficulties that the NHS is facing and will face if there are indeed more cases presenting themselves at hospital, versus the situation that Donald's describing, which, without wanting to put words in his mouth, I think he would want to see things move forward a little bit quicker, akin to what's happened in England. And that's an almost impossible situation for the government to manage. Now, from my perspective, I'm fully supportive of the cautious and more considered approach that's getting taken here. I'm in London at this moment in time, and all we hear from MPs in this city at this moment in time is about the chaos being caused by the pandemic. Hundreds of thousands of people being told that they need to isolate because they've literally just opened the door and the horse is bolted and there's no plan. What I would prefer to see us do, and what I think is the Scottish Government's plan at this moment in time, is to ensure that as we move out of this, we do so in a managed way, which ensures that we don't have the challenges that are facing England at this moment in time.
Can you answer Donald's concern? First of all, they weren't properly consulted. Secondly, they're hearing rumours that they've just been factored out, frankly, and the expectation is they won't be opening anytime soon.
But Brian, I'm obviously not privy to the conversations that Donald's had with others, and it would be remiss of me to try and comment in relation to that. But as far as I'm aware, there's been no discussion about writing nightclubs out. I've frequented Donald's nightclubs on many occasions in the not too distant past, actually. And I look forward to
me. I didn't know you were. What would you describe? Are you a young raver or something? Of goodness gracious me!
I'm only, despite the bald head, Brian, I'm only 32. The lack of hair belies my age. But I want to see a situation. I think everyone wants to see a situation where the economy is back open and we can do everything that we want to do. But what we don't want to do is follow the mistakes that are being made in England. You know, I said earlier on today in a different interview that England should be following Scotland's, not just Scotland's lead, but Wales's lead. And I believe that that's the right approach to take. And if anything, I think that's the right approach because of what Kay has outlined at the start of the discussion here today.
I think the last time I was in a nightclub, it was called a discotheque or quite even possibly a ballroom, but never mind that. Let's go to Russell Findlay. Russell, what do you make of the Scottish Government's handling of those twin areas, those two areas, the leisure industry and the health sector?
Well, first of all, I better declare an interest in that I have also, in a many moons ago, been an attendee at Donald MacLeod's venues. I think.
Yeah, Donald, you've got customers waiting, knocking at the door. Russell, go for it. What do you make of the two sectors?
Yeah, well, I mean, Donald clearly is a reasonable and patient man. He's not, making criticism just for the sake of doing so. We've seen throughout the pandemic a lot of confusion around business support. At one stage, there was so many different business grants, it just caused mass confusion. Local authorities were complaining that these were getting dumped on them by the Scottish Government. And I remember, in fact, one particular local authority put on its website, "Please do not apply." They couldn't cope with the deluge of applicants. So there has been confusion throughout, and a sense that the Scottish Government are passing the buck to local authorities. Going back to the NHS, I mean, what Kay says, I think probably most of us have experienced and seen examples of the pressure that's at play. I've got a very close relative, in fact, who passed away just a week ago, and she entered Queen Elizabeth Hospital in Glasgow and didn't come back out. She had a recurrence of a very aggressive cancer, and what really struck me about obviously the difficulty of that situation was that she had 3 telephone consultations with a consultant penciled in over the past 12 months, which each of which was cancelled. The next consultation is in a couple of weeks' time, and it's desperate, and there is great pressure. We know that, and that's why two things we should be mindful of and grateful of, and I'm quite sure Stephen will bring himself to agree with me, is the foresight of the UK government in acquiring and distributing the vaccines as effectively as they did, and also the Scottish Government being in receipt of huge sums of additional funding in order to help the NHS and other sectors.
Would you accept, though, with regard to the Scottish Government's approach, that Nicola Sturgeon has been right, perhaps, arguably right, to be cautious, given the fact that the numbers in recent days and weeks have actually risen rather than going down? Okay, that appears to have peaked, but they have risen. And, you know, you could say the UK government hasn't exactly been a model of consistency when it comes to the messages that they've been sending out in terms of communications.
Well, I mean, Nicola Sturgeon has, had her near daily TV appearances. Frequently, she does not disclose matters of public health when it seems that she should. Often, these don't impart any significant, meaningful information. And I think the differences in approach have been somewhat exaggerated. That there aren't really huge divergences. I mean, just this week, talking of messaging, we had the Deputy First Minister and COVID Recovery Minister tweeting a graphic that was deemed to be fake, that contained false information, which risks undermining public health. So I don't think the Scottish Government are masters of COVID communication.
Just briefly on Donald's point, would you now be opening the nightclubs? Would you be giving them an opportunity to get out of the debt that they've accumulated to start trading again?
Yeah, well, it's a desperate situation. It's nightclubs, but there are all sorts of businesses which have been unable to function. I mean,
yeah, on the nightclubs, we've got Donald MacLeod here. We've heard his concern. Would you say they should open? They should, and licensed premises should be able to open beyond the current cut-off point of 12 midnight.
Well, the date of 9th of August has been agreed to be a point where much more opening up is going to occur. And I believe that is a reasonable date to do so.
To open then. Okay. Thanks for that, Steve. Brian, what do you make of the points made there by Russell Finlay?
I think there's a couple of things I can come back on. The first one's in relation to confusion over funding. I used to sit on a local authority until I was an MP, and I vividly remember one of Russell's colleagues now, who's in the Scottish Parliament, constantly talking about the fact that he wanted the local authority to have more power when it came to distributing such things as funding. So I'm a little bit confused by his approach in relation to that. But if we are going to look at funding, if we compare the situation in Scotland to the situation in England in terms of business rates relief, obviously we're all well aware of the fact that in Scotland, for rates relief for retail, leisure and hospitality will be for the entirety of this financial year. That is not the case in England. If we look at furlough at this moment in time, the UK government have opted to cut furlough support, despite the fact that Scotland and Wales are still in a situation where we're putting public health first. And just in relation very quickly to the image that was shared by John Swinney, it was of course a poor choice of graphic, and I think he's accepted that, but it had an important public health message at its heart, and that's in stark contrast.
It took him 48 hours to accept it was wrong, and that was only after we reported on the UK Statistics Authority.
For context, if I can finish. If we put that into comparison with the WhatsApp messages which were released by Dominic Cummings in relation to the Prime Minister, showing a blatant disregard for human life and suggesting that you'll live longer if you get COVID, I'm not going to get myself too ruffled by this full outrage by the Tories when their Prime Minister is acting appallingly.
Thanks very much. Let's bring in Kay Sellers. Kay, we had mentioned there about vaccination, people not getting enough vaccination. Do you believe there could be more done on that? Do you believe perhaps we need to go down the road of, I don't know, vaccination passports to allow people to move around a bit more freely? It's really difficult so far. Have we reached a point where we're a bit stuck on the vaccination targets? What's happening in vaccination, basically, Kay?
I mean, it's interesting because I've just been listening to this discussion and thinking, when we just need to move on in Scotland, to move on from these kind of where's worse, England or Scotland on different levels, and move on to just getting some kind of consensus and movement about how we're going to move forward and how we're going to get our services running in a way that will be better for the people of Scotland. So it's what has happened to the vaccine programme. I think that's what we're all asking. What are the best routes to make sure people take things up? I'm not sure that making them compulsory for certain groups of workers is a positive way forward to improve that rate. It's about the practicalities of getting it open. And clearly, we've moved from inviting people to get a vaccine to drop-in centres. I'm not sure that message has got across properly. I noticed the other day that the government little advert that they put out, and it's clearly the one targeted at young people. It's got the young people saying, when I roll, but it says, when I get the call, I'm going to roll up my sleeve. Well, you're not going to get a call. You've got to sort it out yourself. And so
you think there's mixed messaging? Yeah, okay. Oh, Donald, in the nightclub sector, one suggestion is vaccine passports. You're able to show that you've had two vaccines. Health Secretary Hamza Yusuf is saying he's really not convinced by that, and others are concerned that some people are not able to get a vaccine. They're concerned that some are cut out. Others are concerned at the civil liberties. In practical terms, would that work for the nightclub sector? Would you see that as being a useful way to go forward?
We explored this issue last year, been back to live with various bodies and government, and it was always knocked back, to bring in some sort of vaccine certification. I think we were calling it back then. And we were very surprised when Boris announced on Monday, and dismayed actually, that it was going to be a mandatory requirement. And at the end of September, why the end of September and not now if there's a problem, and that testing would not be allowed. Now, we were looking to the Scottish Government again for guidance and not getting much. Hamza Yusuf has said it could be discriminatory, and the First Minister has serious ethical questions, as we all have on it. But she hasn't ruled it out. And in fact, in today's Herald, I think it was saying that they're actually actively working on an app.
Yes. Now, the Northern Ireland company that did the previous app, yeah.
The apps haven't been that successful, and tomorrow in my column in the Herald, actually, we are in very big danger here of turning the UK en masse into a two-tier society by bringing this in and excluding those who, for whatever reasons, don't want to get vaccinated, turning them into second-class citizens. That is a great danger to democracy. Well, if we have to use it, we will, but at the moment it would be a beer-stained piece of paper that would have to be produced and photocopy, and the photocopiers would be red hot. So it's not it's not well thought out. But
what you think folk would just get round it? It wouldn't be a formal medical document, yeah.
But Brian again goes back to the central issue that I have with the government at the moment. They don't give us enough information. They don't tell us enough. The guidance is all over the place, and we're left making it up as we go along, and that is damaging. It's damaging for all sectors. Is there to be a vaccine mandatory vaccine passport? Please let us know, instead of pussyfooting about maybe, I don't know. That's not good to anybody, and least of all people in my sector who would have to administer it. We're getting treated as a political football here. It's been coerced almost into using it if it was to come to fruition. That is fundamentally wrong.
Stephen, Donald MacLeod has a point in that there just hasn't been, maybe it's understandable, maybe it's a good reason, but there just has not been clarity from the Scottish Government on this business of vaccine certification. There's been, Hamza Yusuf saying, we're looking at it, but we're not sure. We hear today from the Herald that there's a company being asked to look at the prospects. We're just not getting answers, Stephen.
Yeah, and I understand that. I'm very sympathetic with what Donald's saying in relation to this. And there's obviously, I don't think at this moment in time, a right answer that everyone is going to unite behind. There's obviously clear ethical issues in relation to creating a divided society, as Donald's mentioned. The capacity potentially for people to have to reveal their medical history to, I don't know, a doorman or bar staff or whatever. But there's also practical implications for those in Donald's industry of being able to do that, and how you would process that if you have hundreds, if not thousands of people attending venues. So I don't know if there is a right approach in relation to this at this moment in time. I remain to be convinced that it's the right thing to do. But the one thing I would say, and it's what's happening here in England at this moment in time, is that the UK government are stating that is going to be the case. Even though nightclubs are already open now, they're stating from the end of September that people will need to get a vaccine passport. But it's almost being used as a stick to beat younger people to get the vaccine.
To go and get the vaccine,
and I don't think that's the right approach that should be getting taken here either.
I see Donald MacLeod raising a hand. Donald, what do you want to say?
The other issue I would like to point out here, it'd be far better if the government actually did their job, and I mean the Scottish government as well as the UK government, and found other ways, more enlightening ways to get the 18 to 30s vaccinated. As an industry,
if they're invited to go and they won't go, you could maybe do need some
other ways of maybe doing it. I don't have the solution, but
no, I understand.
The vaccine rollout program was lamentable from the start in Scotland. It picked up, and now what was it? 2,000 people, 2,018 to 30s a day getting vaccinated out of 260,000. That's do the maths. It's well over 100 days. That means they won't be vaccinated till after Christmas. So that more effort should be applied here. And shutting down the massive vaccination centre at Hydro for cops in November was just disgraceful.
Well, it's 100 days to COP, and I guess they have to get ready. That would be the argument. But I hear what you're saying. Stephen, you were shaking your head there. Just briefly, I'm going to bring in David and Russell Finlay.
Yeah, the notion, like, I'm open to the government being criticised where I think it's fair to do so, but the notion that the vaccine rollout has been lamentable, I think, is false. I don't think it is lamentable. And if you look at the rates at this moment in time, Scotland is punching exactly where it should be, if not above, in terms of vaccines getting into people's arms. There is, of course, the key point here of how we get younger people to take up the vaccine. Now, as I said, I'm just out with that age group. But I know people who are sceptical about it, who've been told for 16 months that this is going to be an illness that affects older people, and they're rightly sceptical about whether they need to get it. But if Donald or anyone has ideas about how we encourage it, we should listen to them.
The vaccine, Okay, David, we're not getting certainty on a number of things. One of them being vaccine passports, another one being whether young people should be vaccinated or not. The argument there was the Joint Committee, the JCVI, said only those that are in vulnerable circumstances. But Nicola Sturgeon was saying she wants a review of that as well, wasn't she? I mean, we're not getting certainty, but perhaps it's for good reason or not. What do you reckon?
Yeah, I think on the vaccines, the Scottish Government has been guided by the JCVI throughout this, but I think Nicola Sturgeon wanted to make it clear that she doesn't want to rule out completely that young people won't be have this blanket vaccination. But as you said, there's a lot of caution about everything. It doesn't give a lot of people certainty. There'll be a lot of parents worried about that, given that the schools will be coming back not too far from now. And we're still waiting for some sort of guidance around isolation for the school children as well.
Let's bring in Russell Finlay. Russell, what do you make of this? I mean, maybe the uncertainty is reasonable. I mean, this is a damn difficult thing to deal with, a global pandemic with hundreds of thousands and millions dead. Maybe a bit of uncertainty in those circumstances is understandable.
Yeah, I mean, we're talking about the vaccine passports. Going back to what Stephen said, he caused me to chuckle slightly when he said he'd be willing to criticise the government as and when required. Presumably means the Scottish government, given that SNP members are not allowed to criticise one another. I'll take that with a pinch of salt. But he also said that we are punching above our weight, or we're where we should be. But just at the weekend, there was a report in the Times newspaper that targets have been missed by 10% in the younger age group. Yeah. And also the drop-in centres in Glasgow, almost half, 40% of them are operating with part-time hours. Why? I mean, it's simple stuff. You know, we're fighting, as the analogy has long been made about the race between the virus and the vaccine. Yet often we see these examples of failure to show any sense of urgency or joined up thinking.
Let me bring in Stephen Flynn to give a quick. All right, Kay, you were raising your hand. Kay, go on, go for it.
I suppose I just feel as though the discussion has gone back to which government is the best or which government is most evil here. And actually, in Scotland, we've got a health service that is under enormous pressure. We're not many weeks away from our schools returning. Yeah, let's talk about that. There's still huge proportions of the staff in those schools who've not had their vaccines yet. The same in our nurseries, early learning centres. So again, lots of things that will be reopening, and we know the vaccine is helpful. So I suppose I want us to be on a discussion about what we're going to do, how we can move things forward, how we can get as many young people as possible vaccinated, particularly workers who will definitely be going back to their work very soon, so that there will be enough staff to open our schools. Because if are we
ready for the schools returning, Kay? Are we ready for the schools coming back?
So far, I'm not. We are obviously we're meeting regularly. The government, they're looking at new guidance. They're looking at what can be relaxed and what can't be relaxed. But until we're clear about the numbers of people who can be vaccinated, it's very difficult to see how you can run a school safely by keeping the staff safe if they're not all vaccinated. So these are the issues that we're discussing with them. This is where we're trying to make progress.
Would you argue for vaccination of young people over 12? Nicola Sturgeon said it over the age of 12. Nicola Sturgeon said that was something she was still looking at, but the JCVI were saying for now, on balance, no.
Well, as I say in all my
universal
meetings
vaccination
with the Scottish Government, I'm not going to play amateur epidemiologist, and I've got a degree in social sciences. The question is, what does the JCVI say? What do public health say? These are the people that we go to for those questions.
Yeah, okay. Stephen, are you willing to play amateur epidemiologist? I would have thought not. But seriously, we've got this question of whether we vaccinate young people in the 12 to 17-year-old at the moment, year-old section. At the moment, it's those who are vulnerable for a variety of reasons. Perhaps there's somebody in their family that's vulnerable. But in terms of generic vaccination, it's currently no. Again, it's uncertainty. It's the sort of thing we're hearing from Donald and Kay and David, that it's an uncertainty coming through.
Yeah, and I think that's as has been covered off, of course, already. The JCVI have been asked to reassess that situation. For context, I have a horse in this race. My wife is a secondary school teacher, and we talk a lot about the situation in schools in Scotland, and have done for a number of months since she went back to being physical within the school and teaching the kids face to face.
Did she feel apprehensive when she went back in? Was she concerned for the staff, concerned for the pupils, concerned generally?
Absolutely, and that's entirely understandable. I think we've all been apprehensive at different moments in time. I'm very apprehensive at points when I'm travelling down to London and changing with different transport networks and the like. But the going back just a couple of steps, Brian, to what Kay was saying in relation to getting our younger people, so the 18 to 30 cohort, vaccinated before we deal with the JCVI situation. If there are ideas, then we should be encouraging people to talk about it. I've seen stuff with football clubs where football clubs have had the players all getting vaccinated on the day of a game to try and encourage other people to do it. Innovative stuff like that, where they're perhaps a role model can try and put that message across. But I don't think
doesn't seem to be working. Donald, you had your hand raised.
Yeah, I was just saying, like obviously with the age demographic that my clubs work with, and a lot of them are students, and it's not going to be long before the students are back on campus, whether they go into the class. And, it's maybe the messaging, the way the messaging is directed. The government could be looking at that, saying, you've got all these students there. Have you been vaccinated? Why not? This is the benefits. And, this is that type of messaging. So you've got collection. I remember being at school as well, getting the BCG jag, and there'd be queues going all the way around the corridors to get them. And very few people at that point would say no. It became an act of bravery. Have you had yours? Look at mine. That there is ways of doing it, but they're not exploring these ways. And it's not about, I'm not having a go at the Scottish government here. The English government are the ones that are bringing this mandatory vaccine package out. So both are at fault, but both maybe are not getting the messaging right for the kids, for the youth.
Russell, do you? Sorry, Donald. Russell, do you believe there should be mandatory vaccination? Do you think we're going to have to go down that road to get that, if you like, stubborn section that won't be vaccinated voluntarily?
Well, just before I come on to that, Kay made a very good point, a very wise point, which is she's sick of hearing comparisons between Scottish and UK governments. Scottish nightclubs, Scottish schools, Scottish NHS, Scottish businesses are entirely the responsibility for this SNP government. In terms of vaccinations of younger people, I think we need to follow the advice of the JCVI as we have done throughout. There are times throughout the pandemic, if I were an amateur epidemiologist, I would be perhaps inclined to give vaccines to, say, frontline police officers sooner than that has actually occurred. But you have to follow that expertise and advice.
It's been a real challenge, hasn't it, David, throughout to get this right? But I mean, is there still a degree of concern among the population as to the risk of vaccination? Is that something? Are they getting that sort of information online and perhaps I don't know, getting the wrong ideas from it, or maybe getting the right ideas from it, but getting concerned anyway.
Yeah, I think there is vaccine hesitancy amongst young people in particular. And that's the messaging is important from the Scottish Government. It was touched upon earlier, sort of John Swinney's sort of graphic that he used, which was inaccurate. And that sort of thing needs to not happen, because we need that confidence to be there from young people who go on social media and get their news from elected politicians. And that confidence has to remain to be built up. Otherwise, these levels of sort of young people taking up the vaccine aren't going to improve.
Stephen, what can be done if it isn't compulsion, if it isn't statute? What can be done to I mean, Nicola Sturgeon at her news conference on Tuesday, she was virtually pleading with people. She was pleading with people to get vaccinated, saying it was the single biggest thing that could now be done, remain to be done to tackle the pandemic.
Yeah, and I think we all are right across the entire UK. That every nation is in the same situation with young folk, and we're all pleading with them. I say young folk, some of them are only a couple of years younger than me, but with young folk to go and get their vaccine. It is the safest step forward. I'm aware of folk who haven't gone for their jab because they had plans and they were worried that there was going to be little side effects, not feeling well for a couple of days and didn't want to ruin their plans, who've subsequently actually picked up COVID. So it's... then they've recovered from it, so they're saying, why would I perhaps need to go and get the jab? But what we need to get across is that there is potential challenges, health risks, if you are younger and you pick up COVID. It's not as severe or as likely as if you're older, but it still exists, and we can all do our bit by going and getting our jabs. I'll be getting my second one in a couple of weeks, and all we can do is encourage people in any way, shape or form to do so. And like I say, if anyone has an ingenious idea as to how we can step that forward, then we should be listening to that.
Kate, please, yeah.
I kind of want to stand up for young people as a kind of parent of an 18-year-old, so not really in a unison capacity as such, but there are practical barriers, there are difficulties in young people's lives. They've often got the kind of jobs where you can't get. I mean, I just didn't have any meetings. They have to schedule any meetings the afternoon of my two jabs. I could nip out and get it. I could nip back. That's because the nature of my employment and the nature of my employer, that's not there for lots of young people. They're also, you're not only is your job usually like that, you're also not you've not built up that confidence in the workplace to actually say, I just need the afternoon off. I'll be gone for an hour. I'll be back. And lots of young people they move house a lot. They didn't get the letter. They weren't in contact. I mean, there are real practical barriers.
The address is wrong. I thought that would be a big case. Yeah. What's it like in the health service, Kay? I mean, it must be just challenging beyond description to be working in the health service, but challenging beyond anything to be working in a hospital where there are COVID wards.
People are just exhausted. I think we shared some of the bits from our survey with you earlier on. We surveyed the staff earlier, Jules, and it is that level of exhaustion. Everyone is used to working really hard for short periods of time, but this is now almost, a year and a half into not only working at a really high level of intensity, but often out with your specialism, which adds intensity. And people are just ground down and exhausted by it. And sadly, many people are thinking to the future, thinking about taking early retirement, thinking of changing their careers and moving out with the health service.
Really as bad as that? Really as ground down as you say as that?
Yeah, it's just a huge level of exhaustion, and people and concerns about this next stage. I think everyone is concerned about this next stage, because in a way it was easy to shut down the country and focus on COVID. And partly this is the discussion we're having now.
Yeah. Stay at home, save lives. Easy message,
Easy message, quick, in you go. In many ways, I think lots of people surprised that, as ever, how well behaved we all are, and most people followed the rules. This next stage is very difficult, and there is a huge swathe of undiagnosed illness that is going to pile into the health service, and people are really worried about that. There just aren't enough staff, so we are going to have to...
Russell, Stephen, that's really worrying. The thoughts we're hearing there about the health service. Russell first, then Stephen.
I mean, I know we don't have a huge amount of time, but
please,
we've not even had time to mention long COVID, which our party's been particularly vocal about. My colleague, Dr. Sandesh Galhani, who's also a GP, saw 60 patients in one session. And that probably speaks to the pressures from top to bottom. Yeah. But he and we have identified the need for the Scottish Government to recognise this huge problem of long COVID, create specialist units that can deal with this, and don't get caught short. We know it's coming. We need to plan.
I think also over a range of areas, there will be levels of PTSD amongst various workers who've had very difficult times through this within the health service from the stress. I don't represent police officers, but I suspect there will be lots of difficulties there. Other workers, just the kind of level of drama and stress.
So you're talking about tensions building up, difficulties building up. Stephen, what do you make when you hear that sort of thing in the health service in particular?
Yeah, and I've heard it firsthand from my mum, my sister, my auntie, who all are nurses and who've been working throughout this pandemic, and it's obviously been incredibly tough for them, and I've worried about them extensively throughout the pandemic, and that's why, just going back to the start of the conversation, we need to continue to take a considered, careful, cautious approach to unlocking, because ultimately, yes, we may not have the huge numbers that were there before entering our hospitals, or potentially even greater numbers had it not been for the vaccine rollout, but there's still going to be pressure upon the NHS, and if that leads to cancellation of other treatments, etc., there's a knock-on impact upon the staff and upon patients. And we need to be mindful of that in everything we do. And I think the government has managed to deal with that situation as best as it possibly can. But we can't lose sight of that moving forward at all.
Let's bring. We're almost. Oh gosh, we are almost out of time. Let's have a final word from each. David, where do you expect this to go next? We're looking to 9 August. What do you expect next?
Well, Nicola Sturgeon will probably give an announcement the week before the 9th, just to update on what her intention is. She was pressed at her briefing earlier to give a bit more notice, but she wants to be using the most recent data, which is fair enough. But for businesses like the nightclubs, they need that sort of notice to get ready for it. They're going to have to put there'll be a lot of guidance that they'll need to sort of put in place beforehand. But at the moment, it's all going to hang on whether she feels we're ready to completely go beyond level 0 on the 9th. That's dependent on all over 40s being vaccinated, sort of as a milestone to unlock that.
Let's bring in a slightly different question to Donald and to Kay. Donald, what do you need to hear next? Donald, then Kay.
A more confident way forward, a map that's not based every 3 weeks, something that's got a more long term. We book acts 6 to 8 weeks in advance, months in advance. We just need more certainty, and we certainly need more engagement with ministers and at crucial times like this to give the industry confidence, because at the moment, as I said earlier, not many of us have much hope of getting opened or being told we can open come the 9th of August. We think it's a red herring.
Thank you very much. Kay, what does the health sector need to hear?
So what we need to hear is there will be a science-based approach, that everything will be measured, and that the health and safety of staff in all workplaces that are being returned will be crucial to that decision-making, and whatever mitigations need to be in place as things reopen, that staff get properly trained and properly protected within that process wherever they work.
Thank you very much. Same question, Russell, then Stephen. What do you need to hear next? Where should we go next?
Well, I mean, I think my concern is we've got Hamza Yusuf, who just the other day suggested there wasn't really a crisis, and I think by any measure we're in a crisis, and that is not going to get better quickly. I think what we need to do is focus on long COVID with urgency, and as far as August the 9th goes, that needs to be the date we aim for. We can't sit back and we can't kick it further into long grass, and the restrictions need to end safely and responsibly.
Stephen Flynn.
I think public health needs to stay front and centre, and I have no doubt that the First Minister will seek to do that. What I'll be calling for, what my colleagues down the road will be calling for, is that financial support through furlough, etc., to be maintained, because we can't see that cut at this moment in time, particularly when we know the challenges that are in front of us.
Thanks to absolutely all of my panel. Thanks to the guests. Thanks to all of you for listening as well. And it'll be a tremendous podcast focusing, of course, upon this simply hideous plague of coronavirus. From me, Brian Taylor, toodaloo the new.